remote work, masking, vaccines. It's been 5 years since COVID turned our world upside down. The virus has been blamed for more than 7 million deaths worldwide, although the data, like everything else about the virus, is still being researched and updated. Our Tristan Kleinfelter is looking back at what's changed and what we've learned in the last 5 years.
On December 19, 2019, a cluster of patients in China's Hubei province and the city of Wuhan began to experience the symptoms of an atypical pneumonia-like illness. Little did anyone know the illness they were experiencing would cause worldwide shutdowns, long wait times for testing, and millions of deaths, along with some lifestyle changes that would be permanent. Word spread through televisions and newspapers. Some responded with sheer panic. Others laughed.
I remember we were almost laughing about it because it was oh wow, there were there's stuff on the internet about it. This is so crazy. This will never affect us all the way over here.
But COVID did reach us, along with every corner of the globe, within a matter of weeks. And life as we knew it changed. On January 20th, the first laboratory-confirmed case of the 2019 novel coronavirus in the U.S. appeared in Washington state. On January 23rd, Wuhan, China was placed under lockdown. January 30th, the CDC confirms the first person-to-person spread of COVID in Chicago, bringing the total number of cases to 7. March 11th, 2020, more than 100,000 cases in 114 countries, and the World Health Organization declares COVID-19 a pandemic.
With this effort today, I am officially declaring a national emergency.
In Pennsylvania, the first cases of COVID were recorded on March 6.
We expect right now that COVID-19 will spread throughout Pennsylvania.
On March 15th, states began to implement shutdowns to stop the spread of the disease. You may recall the phrase 3 weeks to flatten the curve, but the restrictions lasted much longer in states like Pennsylvania. Masks were also mandated, whether going to the store, the park, doctors, almost everywhere required a mask. Some fought, and some followed. Juniata's current public health director, Dr. Tia Warwick, was in New York at the time as a research director for the University of Buffalo Neurosurgery.
We were really short-staffed. Many departments that were specialty or weren't specifically necessary were shut down. So many patients couldn't have access to doctors. There was an issue and shortage with medications.
The first documented COVID death in PA was on March 18, 2020. Former Governor Tom Wolf had businesses close, and soon after, stay-at-home orders were put in place statewide.
New cases are beginning to appear in other counties that suggests community spread is happening.
With businesses struggling to make ends meet and countless people no longer collecting a paycheck, the federal government began issuing assistance payments. Clearfield County was able to give grants to businesses to help keep doors open.
We based it on what we were given. If you showed us that you had a need, we paid. Other companies, if they showed that they were still profitable, we didn't.
Meanwhile, hospitals were overcrowded with more and more patients admitted for symptoms, some requiring respirators.
Definitely we were seeing far greater numbers of patients not only being positive, but being hospitalized with COVID-19.
Grocery stores ran low on supplies, including toilet paper, hand sanitizer, bacterial wipes, and general cleaning supplies.
It's like everybody just came in and wiped out everything.
I haven't seen hand sanitizer anywhere.
We wanted to go get some hand sanitizer, some toilet paper. Shelves were empty.
With the state shut down, most schools moved to virtual learning, and much of the workforce started working from home. And while remote work has remained for many, providing more flexibility, the transition was clunky at best.
Now we've kind of adapted and created more hybrid online opportunities for students, and we kind of are pushed into the future.
Another milestone during the pandemic was the creation of the vaccine. In the beginning, a vaccine shortage left all of us struggling to find the shots. Pharmacies created wait lists. Today, the COVID vaccine is readily available to anyone, and medical experts say we'll be better prepared for future pandemics as long as we learn from COVID and don't become complacent.
I think that people have been desensitized and almost still kind of working through the trauma of COVID, that definitely are more prepared and more aware for sure, and to take those precautions for themselves. But as far as going into the same panic, I think it's an opposite effect.
Today, COVID has waned, but other viruses are on the rise. Viruses that could be prevented with precautions and proper hand washing.
influenza A is now causing more hospitalizations than COVID or RSV are.
5 years after it was first discovered, the impact of COVID is still being counted. According to USA Facts, Pennsylvania saw more than 3.5 million reported cases, resulting in over 50,000 deaths. Looking back, there was also lost revenue, increased costs, education loss, and a psychological toll that's simply impossible to quantify. Reporting for WTAJ News, I'm Tristan Kleinfelter.